Hi, I'm Dr. Montagna. Today we're going to talk about some interesting things as far as Lyme disease goes. We're going to start off with a subject that really isn't touched on much. That's hormonal dysfunction and what that has to do with intimacy and intimate relations. As far as Lyme disease, and really this is something that's fairly typical with a lot of chronic disease, but it's got a few extra twists to it. We're going to be going through some very, very interesting things. It's really kind of different, so stick around to the end. You'll appreciate the fact that you did. So one of the first things to talk about is just the huge difference in the way men and women look at each other. Men tend to look at themselves in the mirror and see something that's way more attractive than what may be really there. Women are typically the opposite, and it's a matter of perspective, which is an important thing to address as far as when we look at hormones and intimate interaction, because a matter of perspective is really huge. The view of a woman toward herself lends itself to need to approach her a whole bunch more tenderly, a whole bunch more gently than a male would, because she's a lot more fragile. Is not really a good word, but I can't think of a better one. A woman tends to be a lot more sensitive than a man is, and because of that, it's a lot more important to approach this more sensitively. So when we start looking at the anatomy of a female, most people kind of have a clue as to what it looks like from a front view. But when we start to turn it to a side view, we start to see something that I'd like to go back to embryology and show that men and women really aren't that much different. We all start basically the same, from the same tissues, and things differentiate from there. But the standard place we all start from is a lot closer to the female anatomy than it is to the male. If a male's going to be a male, it's somewhere around 7 weeks where the testosterone starts to develop in the fetus and a bunch of changes start to happen. The uterus is held in place by the round ligament that kind of wraps itself around the bladder, and that's what holds the bladder in place. That's part of the reason why women have such a problem with prolapsed bladders if they ever get hysterectomy, because there's nothing to hold the bladder in place anymore, and it can just flop around in the bottom of her abdominal cavity, and that's usually not a good thing. So when we start to see the testosterone start to rise up, it makes what's the women's uterus, it makes it drop down, wrap around the base of the urethra and become the prostate glands. Then the ovaries grab the round ligament with them, drop down through the inguinal canal into the labia. The labia become the man's scrotum. The seam in the bottom of the scrotum is where the labia fuse together. The ovaries become the testicles, and the round ligament becomes the spermatic cord. Then in both men and women, there's 3 erectile tissues in their clitoris and a man's penis. In a clitoris, one erectile crux is what they're called. One division stays in the clitoris, one division goes down into both the labia majora, and the engorgement of that, or the erection of that, helps open up her reproductive tract for any kind of engagement that's going to go on. If it's going to be a male, those 3 cruxes, they stay together, they wrap around the urethra, it elongates, and that becomes a penis. With that, it's a very interesting thing, because when we start to look at sexual interaction, it lets all of us know that there's a counterpart in the opposite sex that we have, and if something is pleasurable to us, it's probably pleasurable to them. Something that's not so pleasurable would be the same for the other counterpart. And the other thing that's really interesting with looking at anatomy from this standpoint, it gives a lot of the reason why the same hormonal problems that women have affect the same tissues in a man and create the same problems. All the problems that women have with their uterus is the same problems men have with their prostate. Prostate's just a harder thing to surgically get out of there, but it's toxic estrogens that create the problem in both of those. So, and HPV virus also is a big player in that. So, just trying to level the playing field here so that it's fairly clear that the whole issues of the hormonal dysfunction we're going to go through has to do with both men and women, even though we're going to use women as a model for this. Women typically, they got three primary hormones. Estrogen, which is the one that creates the most fire. It's a menopausal hormone. It creates the growth that can turn into serious lesions like cancer, things like that. Estradiol is a E2. It's the hormone that's most prevalent during her cycling years. It's responsible for all the uterine secretions, the cervical secretions that keeps her reproductive tract wet, lubricated, breast cycles, the breast engorgement that goes along with cycles, things like that. And estradiol is E3. That's the most common hormone that's present during pregnancies. Most of that's made by the placenta. When we start to look at the estrogens in here, estrogen more common in menopause, estradiol more in cycling, estradiol more common in pregnancy. When we look at the hormonal cycles, there's a part up in the side of our brain called the hypothalamus that reads all our circulating levels of gases, minerals, hormones, things like that. In the case of hormones, most of that information will turn around and communicate with the pituitary, which is right about in the center of our head. The pituitary will then send out other hormones to target organs to tell them to do different things. In the case of a woman's cycle, and it's the exact same thing with men producing sperm. The first hormone that goes out is follicle-stimulating hormone. For a woman, that gets all the cells around an egg to start to get ready. They start to produce fluid. They get around the egg. They start to produce estrogen. Also, as the process goes on, when that estrogen levels start to hit a certain level, the hypothalamus reads that, sends out a third hormone called luteinizing hormone. Luteinizing hormone means to ovulate. If there's enough luteinizing hormone and the follicle is ready with the egg, that follicle bursts open, lets the fluid in the egg out. The fallopian tubes are supposed to catch that. And where the follicle was, it turns into something called the corpus luteum, and the corpus luteum is what makes progesterone. The progesterone prepares that egg for implantation. If there's not fertilization and implantation, all of it sloughs off, and the whole cycle starts all over again. Those same scenarios are going on inside a man's gonads, also allowing him to produce sperm at the same time. So with all of those cyclical hormones going on, there's a balance that's supposed to happen. And that balance allows a cycle of estrogens rising, and as they fall, then progesterone rises, it starts to fall. Estrogen is what excites all of the tissues, creates inflammatory issues, bloating issues, fluid retention issues, mood issues. Progesterone is what's supposed to come in afterwards, calm everything down. If a woman's not ovulating, then she doesn't make the progesterone. There's nothing there to calm down all the fire that goes on. This is a common thing with chronic illness, is that women's cycles start to change because of some of the hormones we're going to talk about in a bit. And with those changes, she doesn't get the progesterone to come calm everything down. Once a woman hits the perimenopausal through the menopause and postmenopausal stages, same thing's going on with all these inflammatory fires that go on with chronic disease. There's no progesterone to start to calm things down, and her whole reproductive tract can feel like it's on fire. When we look at some of the things that go on with chronic disease, there's something called the pregnenolone steal. All of our precursors for our sexual hormones, both all the estrogens and the progesterone and testosterone, they're all built off of precursors that come out of the adrenal glands. And the adrenal glands, they make several different hormones. There are the hormones, the stress hormones that are in there. There's hormones that control the kidneys. There's also hormones that are precursors for us to make sexual hormones out of. And if we're too stressed out, which is a common thing for chronic disease, the body realizes some kind of stress, and it starts to react to that. If there's too much stresses going on for us to be able to react to it, the process of making our sexual hormones gets bypassed by something called the pregnenolone steal. The precursors that are headed to make sexual hormones actually make stress hormones. With that, we start to see different changes within cycles and sexual patterns that go on. If that gets to be fairly severe, you can start to see some genital atrophy start to happen in both men and women. There is a hormone that is in our fat. It's called aromatase. That hormone, it will take a man's circulating testosterone, turn it into estrogens, and it can turn women's estrogens into more toxic ones. That hormone aromatase is turned on by cortisol, our stress hormone, and whenever cortisol gets released, it raises our blood sugar so we can defend our lives. Insulin tries to take those sugars and push them back into our tissues. What happens with that whole scenario is the two hormones, cortisol and insulin, turn on aromatase, start to mess with our hormones. Man's hormones turn to female hormones. Female's hormones turn to more toxic hormones. That creates more of an inflammatory cycle, and it really starts to create a nightmare that goes on. If there's any kind of oral contraceptive issues going on, or women taking any kind of hormone therapy, it can compound that issue quite a bit, because with that, she's taking more toxic estrogens, which will inflame the tissues quite a bit more, and there's going to be not an adequate amount of progesterone production to be able to calm all that down. So she's going to feel like she's very much on fire. When we start to look at interstitial cystitis, different things like that, this can be a major impact for, or a major cause why that happens, because of chronic inflammatory responses going on in the reproductive tissues, around the bladder and throughout the reproductive tissues, from a constant hormonal barrage that's going on down there. We really need to be able to address that, calm all that down so everything can calm down. So when we take all of that, we have inflammatory fires, disrupted hormones, inflamed reproductive tissues. This really goes on a long time, start to atrophy. It really starts to affect intimate interactions in a very huge way. And then we add another factor onto intimacy that's really a huge one, is that research shows that there's the bacteria that causes Lyme disease has been found in basically every tissue that we have. It's in 3% of the blood supply in Minnesota and Wisconsin, Red Cross blood supply, so you can get it that way. It's been found in breast milk, across the placental barrier. It's been found in the sexual fluids of both men and women. And when we start to look at that, it allows for something that everybody hoped wouldn't happen, but sexual transfer of the disease is highly probable. And in that, the sexual fluids, there's not a protection unless you start to try and use something. The only thing that would really make sense to try and use would be condoms. They make condoms for men, they make condoms for women. The size of the pore, we have natural condoms, those are typically sheepskin, those can have fairly large pores. The latex ones have pretty small pores. They've done some studies with that, seeing if you could pass some certain substances through the condoms the same size as the HIV virus, which is about 110 nanomicrons. When we start to look at the infective agents with Lyme disease, they're getting close to that size. The Lyme disease is typically about 3 times that diameter, but rickettsia is only 2 times that diameter. It's a really common co-infection with it. Ehrlichia is actually smaller than the HIV virus, and there's also viruses that can go along with this too. So it really raises a question. So how do we safely go about doing this? If it appears that there is an infection in one or the other, the use of both male and female condoms at the same time may be a fairly good option to look at and to try. So if you like this video and this information, hit the like button down below. Share it with your friends, subscribe to our channel. We're going to have a lot more things like this in there. And if anybody has any subjects they'd like to have covered, you send us a message on one of the medias there, and we will try and get something to address that.